Well, it looks like the slides are up, so I'm going to turn it back over to Dr. Liao and Dr. Zambrano.
All right. Well, we wanted to start out by saying we hope this is fun and interactive. Please feel free to ask questions. We'll be checking the chat for them. And wanted to start by addressing our 3 objectives we hope to accomplish during this. We have about 30 minutes of content, but hopefully lots of questions in between. And we wanted to identify 3 major risk factors for heart disease, cardiovascular disease, and then discuss lifestyle tips that we've come up with to address each of these risk factors, and then hope to share additional community resources to help us promote health. So with that, I just wanted to poll the audience. What are big risk factors folks think about when we talk about heart disease?
The unknown happening, and we didn't expect it to happen because we thought we were in great shape until it happens, which is usually attributed to we're not making those medical appointments.
Genetics is a big factor.
Diet to play a factor.
Excellent. We are taking a 3-prong approach. We're going to talk about high blood pressure, diabetes, and tobacco use, which are umbrellas for all the good things you did talk about: diet, engaging with a healthcare doctor. But we'll start out with high blood pressure. We like to think of the heart as a pump, right down the middle, and it pumps blood to the entire body. And we have lots of blood vessels, which we think about as pipes that help provide the blood supply to all the rest of the organs. An analogy I like to think about with high blood pressure, so high pressure in the pipes itself, is one related to gardening. And so as you can see in the bottom right, when you apply extra pressure, when there's high blood pressure, you are watering the plants, but sometimes you might damage them. Sometimes our organs don't like to see such high pressures. And the 3 organs we think about, in addition to the heart, we think about the kidneys and the brain. Those are the 2 main organs that we worry about as having complications with high blood pressure.
If you're diabetic and you have hypertension, are you more likely to have a heart attack?
I'm Sarah. I'm one of the speakers here. I think totally. I think the combination, like, one puts you at risk for having, heart issues, stroke, but the 2 together kind of compound your risk. So it's even higher than either alone, if that makes sense.
Yeah, it does. Thank you.
Yeah. And I think Ted was someone who pointed out, like, a lot of these illnesses, a lot of these risk factors for heart health are, silent. So I think that's like a very astute, observation, because a lot of times things like hypertension and diabetes, which is what I'll get into next, are, not something we necessarily always feel. So it's really hard because sometimes we're not even aware that we even have these things until they kind of progress to something like a heart attack or a stroke or something. So we kind of just wanted to empower you guys to talk to your primary care doctors to kind of get all the right information. But I'll kind of start with kind of a basics of what is diabetes. So there are 2 types of diabetes. One is type 1, which people are typically born with. And then the other is type 2, which is kind of the one I will be focusing on. And I think the one that people commonly think about when they think about kind of risk factors for heart disease. It's, diabetes is very complex, but I'm going to try to break it down as simple as possible. Essentially, when we eat, we're eating because our body needs energy to carry out all of its functions. And in order for us to kind of get that energy from the food, we need this thing called insulin, which is right here, which is the key here. With insulin, our bodies are essentially able to unlock kind of different cells and organs in our body so that we can take up kind of the sugar to get the energy that our bodies need. So in diabetes, sometimes people for different reasons develop problems with this lock and key. So essentially there might be a little bit of insulin resistance. Maybe that key isn't working as super well as it should. Or, you know, there's like a deficiency of insulin, and essentially all that blood sugar that's supposed to go into our, you know, into our cells to give us all the energy we need just stays in the blood. And so you get basically a ton of sugar in your blood that's not supposed to be there. And that kind of has like kind of downstream effects. And essentially, as you know, diabetes can lead to many different things, including, you know, heart disease. It can also lead to kidney problems, eye problems, nerve problems, and a lot of other health problems. But that's kind of the gist of kind of, you know, why we get concerned about diabetes.
You know, when you have a family that has, you know, a lot of diabetes, like all my uncles, I had 5 uncles pass away from complications of diabetes. 3 of them went blind. All my sisters and my mom have diabetes, and I am not diabetic at all or pre-diabetic. What can I do besides eating healthy, move my body, rest, that I can ensure that I don't get this disease? It's both on paternal and maternal side of my family. So it's very, very pervasive. And I know it's preventable. Yeah. But there's also a genetic component to it, which, you know, I have full control over that. But what should I be looking for when I do my labs or when I go for my physical? What things should I be looking at?
Yeah, I think that's a great question, which is like a perfect lead into our next kind of slide. It's like, you know, yes, we have all this information, but I think we really want to empower, you know, everyone listening to really ask their doctors the questions. And we kind of came up with some things that you can ask, you know, given your family history. There are certain things that you can ask. So one of them being the marker that we use to see if someone has diabetes is called an A1C. And so every doctor is different, but I typically will check if someone is not diabetic. I'll check these like every 6 months or so, just so I can, you know, keep track and make sure that we're not heading, that we're not like heading in the diabetes range. So I think that's for your case with like a strong family history. I would definitely talk to your doctor about getting this test called the A1C.
Well, there's one tool that I see that functional medicine is using. It's called the continuous glucose monitor. And I went to my doctor. I'm a fitness coach myself. So I went to my doctor and I asked for that. And she said, oh, no, you're fine. You don't need to have that because you don't have your your levels are all fine. And so it wasn't given to me. And you can't just get it from a pharmacy or anything like that. And that's one of the best ways I was told to continuously track your glucose levels to make sure that your insulin levels are not, you know, off the chart.
Yeah, that's an excellent question. I'm so glad you asked your doctor, because you are right. That is a way to check our sugars over every day throughout the day. Now, what we think about as causing disease or causing complications with diabetes is a long-term effect, not an occasional high after folks eat very sugary substances. And that's why when we check that A1C lab marker, it averages your blood sugar over the past 3 months. So if you ate a big meal that morning, it would not really factor in to that A1C number. Now, why don't we want to know our sugars every day, all day? Sometimes too much information is not good. And we know for a fact that it's the cumulative exposure to extra amounts of sugar, which will be reflected in that lab value, that is what worries us. And for that reason, we recommend folks just get screening through the lab that we mentioned, as opposed to a continuous glucose monitoring. Now, folks who have diabetes that's diagnosed, and especially folks who are using insulin, oftentimes will benefit from a CGM or a continuous glucose monitor. But for folks who have prediabetes or don't have diabetes at all, it is not recommended in the guidelines. Okay, well, as mentioned, there are several things that we can do lifestyle-wise to try to limit risk of high blood pressure, limit risk of diabetes, and by that, we're improving heart health. And so on the top left, we think about alcohol. So alcohol is a high risk factor for high blood pressure when drunk too much. And the guidelines that we have, somewhere between, currently we say 7 alcohol drinks in a whole week for women and 14 for men. We know that the answer is somewhere in the middle, and that less is better. A little bit's okay, so everything in moderation, a drink every once in a while, but once you hit 7 to 14, then we worry about that causing other issues for the heart, for the liver, etc. And then the next thing right over is, trying to get 30 minutes of some sort of exercise, anything that gets your heart rate up. Doesn't have to be running. It could be jumping jacks. It could be stationary things. Anything to get your heart rate a little bit up exercises the heart muscle a little bit more, because the heart, after all, is a muscle. And, things like your biceps, your quadriceps, you exercise those with time. And that's also another way we like to exercise the heart. Low salt, we know, is really beneficial for a decreasing risk of high blood pressure. And if folks have high blood pressure, even more reason to decrease salt intake. Then on the bottom left, we have medications. So sometimes doctors feel like it's time to start a medication for high blood pressure. That doesn't mean that folks are going to need it for the rest of their life. It's not a commitment for the rest of their life. It's just something that for the time being, while folks are working on the other modifiable risk factors that we have on the slide, we might need a little bit extra help to lower the blood pressure. I also wanted to point out some medications that we think about that might actually impact heart health. And so I have 4 really common painkiller medications that folks can get over the counter without a prescription at the bottom. And just wanted to highlight a few. On the absolute left, Tylenol, that is the safest medication for pain that won't affect the kidneys, has little effect on blood pressure. The items to the right of it, Advil, Motrin, Aleve, they do over time, when used for a period of time, do increase risk of kidney disease and of high blood pressure. Your doctor might recommend these medications in short intervals for certain diseases, and that's totally okay. But we just want to know the first thing folks should be grabbing if they have some sort of joint aches or pains are Tylenol, because that is the safest. The item all the way on the right has gone in and out of favor in terms of benefit for pain, and that's aspirin. So right now, we don't recommend anyone taking aspirin unless directed by your doctor. These are folks who have known heart disease. Otherwise, we worry about an increased risk for bleeding, bleeding anywhere in the stomach. And our guidelines are recommending that aspirin is only used if directed by your doctor. Now, we know you can get it over the counter, but as I mentioned, for any aches or pains, things you should be turning to are Tylenol. And then if you need additional pain relief, maybe Advil or Motrin or Aleve. But aspirin, again, should only be used if directed by a doctor. And this is new information over the past 5 to 10 years that we're discovering.
We have a couple questions in the chat. Sorry for interrupting. Is there a difference with salt, like iodized salt or sea salt?
Off the top of my head, I think they taste different.
I can add from my cooking experience, not from being a nurse, that there is a difference in sodium in some of the salts, and some of the sea salts may have less sodium, but it also depends on what kind you get. And that's the limitation of my knowledge on that.
Yeah, no, totally. I think as long as I think in salt, most salt, I think that's like in America has like a specific iodine that is like needed for like good thyroid health. So I don't know if all sea salt has like the proper iodine, but that's kind of one thing I would just ask, look at the label, or bring it even to your doctor's office and be like, hey, is this okay? I'm sure they would be really happy to kind of guide you with that.
There are 2 types of things that we think about with food. We think about what type of food folks are eating, and on the right, we'll see the types of vegetables, carbohydrates, proteins, and then the amount that we're eating in total. Starting on the right side, food composition, or the types of foods that we think about that are healthier for the heart. We have a diagram of a circle here, and we think in general about half of the foods that folks should eat should be vegetables, and non-starchy vegetables in particular. Starchy vegetables would be things like roots like potatoes, squash, corn, and acorn. Those are starchy. But what we recommend for lower sugar content would be things that are non-starchy. Usually the greens are what gets you in that category. So broccoli, asparagus, carrots, green beans, spinach, those are non-starchy vegetables. And we think those should take up a large proportion of the diet. It's always okay to have things in moderation. So protein and carbohydrates, and of course, water hydration is good. But in general, sticking to more non-starchy vegetables will decrease risk of diabetes and also help with heart health. There's a lot more to nutrition that is yet to be discovered, but this part of nutrition we have lots of evidence for. And then at the bottom is a tool that some people find helpful to figure out portions of food that they should be eating. And in general, people can think about their hand and how much protein they should have and vegetables. But the things that I think are really helpful are the last 2 pieces. How much carbs? Carbs should be a little bit less than the other items. And then fatty foods should be even less.
Eating healthy, whatever that means, is really hard. I think even like I can speak for myself, even as like a doctor who like knows these things, I still find myself reaching for like a cookie. And I think the things that kind of help me is just to start like really small. So I think one thing is like, for example, instead of eating like a whole cookie at like my friend's house, maybe I'll like challenge myself to eat like half. And then like the next week, I'll be like, all right, I'm okay without that. And so I think taking these like super small steps is like, actually like really important and kind of a good way, because I know that, it could be really hard to eat healthy. I have a question in the chat. What sources do healthcare providers go to find trustworthy herbal med interactions? Off the top of my head, we have all kinds of resources for like looking up medications. I don't know if there's one that exists specifically where you can like type in, oh, this is like the herbal medicine that I want to take, and like see if it has interactions. But I know that like they're out there.
Usually when my patients come in with a list of herbal medications, my first step is I Google AAFP.org, the American Academy of Family Practitioners, and they have a helpful article with common herbal products. Now, there are always more products that have yet to be studied. And of course, science continues to evolve, but that's usually my first pass go at medication, potential medication interactions. Now be careful, there's a lot of other information out there in the universe of Google that might not have reliable sources. So in general, it's always helpful to send a message to your doctor to see if it's safe to take with other medications, because we know that there's some interactions that might make a medication that you're prescribed more strong or more potent than you might actually want. And so for these reasons, please feel free to talk to your doctor about any potential herbal supplements that might factor into your other medications.
So just to kind of build off of kind of what, like some tips for when you go grocery shopping, or when whoever goes grocery shopping in your household. So, you know, every food item that you buy will have a label, and these are also unfortunately very confusing sometimes, but they can have some helpful information. One thing is kind of knowing the calorie amount per serving, and I think I just wanted to highlight that this, I don't know if you can see my mouse, but this is like the calorie amount per serving, and that doesn't mean per box or like per bag. It's and then it'll tell you up here like how much of that particular food actually means, okay, like maybe like 3 or 4 chips is actually 230, whereas like you may have thought, oh, the whole bag is 230, but it's actually significantly more than that. And then another helpful thing, so I would always just, my takeaway is just to check your serving size, and to check like the calories per serving size, if that makes sense. And then my other tip is to look at this section, the total carbohydrates. And usually they will talk if there is any sort of like added sugar, so meaning like processed, not natural sugar, like high fructose corn syrup, things like that, they'll add it here, and those are like added sugars. And then just some other tips besides like picking out like fruits and vegetables. I personally love frozen vegetables, just because I think they're really easy to make. They last for a while, and so I think that's like a good kind of can be like a good kind of source of vegetables for people. And then also like canned vegetables, if we get them low sodium, I think they're also a pretty good alternative as well to, you know, the like fresh vegetables. So I would encourage you, if you ever have to buy something canned, just try to get it in like the low sodium version, if that makes sense. Just to make a kind of a grocery list, just so I think we all have the experience of going to the grocery store and being hungry and then just like grabbing anything, basically getting everything that is on our mind. So it helps me, I know, to get like, just have a list so that I can like stay focused on my goals.
How about foods or fruits that I imagine cause inflammation? And I'll briefly comment on that this is an area where folks are starting to try to understand a little more. You'll see lots of input from various different online sources and dieting gurus that recommend particular foods. But as of now, we don't have any solid evidence for a particular food that will reduce inflammation. Now, things that help lower blood pressure, so low salt foods, by that nature then might reduce inflammation, but lower amounts of sugar and lower amounts of salt seem to be the only ways that we know, based on scientific evidence, that might decrease inflammation. but knowing that there's a lot more research that needs to be done.
So just some like resources, we can kind of send these slides out or send a list of kind of resources that we're familiar with if that's helpful. But we live in, Boston, which, is imperfect, but has a lot of good resources that I think we just have to kind of tap into. So one of those things, so Mayor Michelle Wu has this like food justice initiative. And under that initiative, there's like different programs basically to help support folks kind of buy nutritious, healthy foods, kind of direct them to like the right amount of foods. So if you Google, food justice Boston, you'll kind of come up with this whole plethora of resources. They have a lot of like community partners where if you shop at like certain grocery stores and you get vegetables, like you get a certain discount, and there's all kinds of things like that. The other program that I wanted to highlight that I didn't know existed until like this past year is this place called Community Servings. It's in Jamaica Plain. And essentially they are, a very big company, and their mission is to kind of provide meals, so meal prep and deliver food, healthy food, to folks with kind of chronic illnesses. And that could be anything from diabetes to high blood pressure to HIV to, a lot of different things. And they have like pretty extensive kind of meal kits, and kind of to meet certain diet restrictions, to meet certain like nutrient goals. And so I just wanted to make folks aware that that's definitely a thing that exists in Boston. And then just like a quick plug for other things in the community, which I'm sure, you all are aware of, but in case you weren't, the Boston Center for Youth and Families, they have a website where basically you can get free, free gym access to different community centers. You can go kind of play like basketball. You can go swimming. I personally play pickleball at one of these community centers. And so that's been like a really great resource and just like a fun community thing that I've been doing recently. Obviously the YMCA has, and the Boston Center for Youth and Families is typically free, which is like incredible. You just have to sign up. There's the YMCA, which there's typically a fee. And then this other resource that I was looking at, Walk Boston. So it basically has like a map, like different walking routes throughout all of Boston. So you can kind of just choose your neighborhood, and it'll be like, okay, walk from here to here. And this is like how many miles it is. And this is how many calories you'll burn, and da da da. So that's just like another cool resource in the community.
Well, we'll conclude our PowerPoint with a brief detour talking about tobacco use. I just wanted to highlight 3 facts that not everyone knows. And the first was frankly surprising to me, actually, that the #1 cause of death from smoking tobacco is not cancer. It's not other lung disease. It's actually heart disease. And folks are often worried about cancer, but heart disease really is what comes about from the increased inflammation that tobacco use causes. And then there's the second fact is there's a fair amount of research that's coming out that's showing that however much cigarettes that folks smoke, that might be associated with an increased risk of heart disease. So every cigarette that's smoked less really counts. However, we do have evidence that also shows that even smoking 1 cigarette a day does increase risk of heart disease. So 0 is the best. Even 1 cigarette a day does increase risk of heart disease, but every cigarette counts. And then the last piece is that smoking does affect others. As we're thinking about infections like COVID, we're thinking about public health and folks around us. And exposure to secondhand smoke also increases risk of heart disease. Not as much as smoking itself, but the secondhand effect does affect others around you.
It was great to meet you all. I'll be back for more. Take care.
Thank you. Good night.
Bye.